An interventional lab in Montego Bay.
So this is nuclear resonance? This machine?
No, nuclear medicine.
Medicine.
Not magnetic resonance,
No.
which is what. So why I mentioned this, why the significance of this one now is with the nuclear medicine camera, you can look at myocardial diffusion. You can also do both. You can do all kinds of things for investigation. The limitation is that if you don't have radioisotopes, you can't do it. I'm a nuclear cardiologist also by training. So what we did was inside that place, I would have made a hot lab, right? So we buy the generator, right? Because if you buy the unit doses of radioactivity, before it gets to you, it's already decayed. And that's one of the disadvantages developing countries have. Western countries have nuclear reactors and they can make this nuclear. They think it's all for bombs. Nuclear reactors for medicine as well. If you have no nuclear reactor, you can't get those unique doses readily. So the only thing you can get is a generator that has, so if you buy a generator with 5,000 millicuries, by the time it's transported over 1 week, when you get it, it may just be 2,000 millicuries. So think about it, if it's $1 per millicurie, you spend $5,000. By the time you get it, what you get is only $2,000.
So how do you capture it?
So that's what we have in the nuclear lab. So we take it to the nuclear lab, we do what is called elution, right? So we have our people trained. You elute the radioisotope and get the unit dose you need for the case. If you don't have the capacity of doing that, then you can't deliver those services. Now, I take it to why it's important. Cardiac amyloidosis is one major problem black people suffer because it's a genetic thing. The allele responsible is called V142I, and that is prevalent in about 3 to 5% of people from Southwest Africa, which has been documented again in the Caribbean, in Black America, and Jason Dungo and some others in the UK recently showed that heart failure, which is a major problem, 15% of heart failure in black people is related to that. But yet,
it's genetic?
It's genetic, right? And in the olden days, not so long ago, it was thought to just be fatal, no treatment and so on. But treatment has been found, right? Tafamidis, patisiran, different things can be used to treat it. But the injustice is that now the communities where these things are prevalent don't have the capacity to even make the diagnosis.
Where it's most needed is not there.
It's not there. And that's why we have things like this. So we're doing a study now, the study with
This is like university.
Amazing
stuff.
I've never seen this before. So where do they have it? They have, obviously they must have
it's all over America and Western Europe and stuff. So interestingly, Nigeria just this year installed one at University College Hospital, Ibadan. That came back from South Africa. So actually, when I was there, I had a discussion, with him, because what we're trying to do now, we have a clinic we built in southeastern Nigeria, Enugu. So we're saying now, when they get those patients from there, I can arrange to get them to Ibadan to get the diagnostic study done and at least know what the problem is.
Right.
Yeah. So we have another lab like this in Mandeville as well.
So this is a form of irradiation?
Well,
Targeted irradiation?
So what it is you get radioactive material that is safely introduced into the system, right? And then we use this to, it doesn't irradiate. It X-ray, it's not X-ray, it images it to check the count density. And so the count density, to give you an example, right?
It's like a radioactive reading.
It's reading, right? If we want to see whether you have blockage in your blood vessel, and then we put you on a treadmill, and then you walk. Theoretically, the blood vessels should open up and flow will go. So when we inject that stuff, it should go equally in all the areas. Assuming there is a blockage this side, some of it cannot get in here. So when we take the
It's
picture,
diagnostic.
right. So when we take the picture, the count density here may be 1,000 pixels, and here may be 500 pixels.
The 500 is where the blockage is.
Exactly.
I will make one request. I wasn't recording when you showed the EKG stuff. I need to record it.
Okay, sure.
Please, let's go back there. Because this is going to our people, so that we know what I'm missing in what I'm missing. Okay, let's do that imaging stuff, the AKG one again. I need to see. Yeah. Okay. I think it was here, right? EKG. Yeah. Yes, I need to record it. Okay.
She's coming out. So
Okay.
God, let me ask you a question. Does your research or your studies include
Look.
nitric oxide effect on cardiac vasodilation?
Well, I've done studies with that in my prior incarnation.
Okay.
Yeah, but the ones we're doing here, we're not using it.
I see. Okay.
Okay. Go ahead. Explain it.
So this is a new technique, new technology for electrocardiography. This is from QT Medical. Rui Kang is the chairman of the company. QT Medical is a professor at UC San Francisco. So what we do here is we use this as an advanced technology as opposed to the big machine that you have to wheel around. So you take this thing and these are the electrodes put on the chest, and then the images are acquired, the electrocardiographic signals are acquired, and it goes either via Bluetooth or internet connection into a cloud server. And when we go upstairs, I'll actually show you where the cloud, where the computer, they can log in, but you can get it, I can get it from my phone, you can get it from anywhere in the world and interpret the study. So technically somebody can go to UDI, for example, do an ECG, and somebody in London reports it within 2 minutes.
Wow. Thanks. Sorry, I need to go this in this thing. Oh, where's the idea? Oh, sorry. Okay. Yeah.
When we go into the other place,
Okay, so we're gonna go in. Okay, go ahead.
This is a probe that we use this to take better pictures inside the heart. We take it, somebody
Down
to the throat, and then it gets to the bottom, and you see here.
The camera down.
Yeah, there's a camera here.
Wow.
This is a transesophageal echocardiogram.
Wow.
So we use that. We can do thorough investigation of the cardiac tissues and understand what's happening in the valves and everything. And I'll show you the lab where we do that.
Wow.
So they just
Person
grab.
be under anesthesia when you do that?
We use what we call conscious sedation.
Oh, okay.
We just give you
I don't know if I can stay awake when you do that.
So this is our urgent care section. So when people come in emergencies, we're open 24 hours, 7 days a week. And then this is a crash cart, this is a defibrillator, so if there's an emergency, they can deal with it here. We have 2 interventional labs here.
Okay.
And another one in Montego.
What kind of lab is it?
Interventions.
Interventional.
Cat lab. We can just
What they do
Yeah,
at
cat
the-
lab.
what they do at the big hospitals.
Wow.
They go inside and look inside the lab.
Whoa. Wow.
So this is actually our outpatient cat lab. We
Yes, it's a cat lab.
Yeah, we'll show you the other cat lab
Wow.
over there. And that's our electrophysiology equipment. we use this to do electrophysiology studies and then find out where somebody with sudden death episodes, we can find out where the arrhythmias are coming from. And then this is an ablation device, and then we use the ablation to ablate the place, burn it off, and then the arrhythmia goes away.
Wow. Wow.
So this is big university stuff.
My God, look at what we are missing in Nigeria. We are missing this in Nigeria, man. Jesus. Stress lab.
Oh,
Reduce the stress.
stress lab.
Stress lab, somebody there.
Yeah.
Okay.
Somebody there.
Look, take a picture of this right here. Accomplished by an observer. There's another cat line. Good lab right here.
I think you can open stems and then so. Oh no, we got but
Okay, looks like you may walk in or still at the door.
So
Order not coming. Just have a seat.
this is one of our echo labs where we do ultrasound, cardiac imaging, echocardiogram. The probe I showed you, we can use it with this machine, so we can connect it. You see here, if I remove one of these, I can put the console of that one there, and then drop it down, and then get the pictures in here. Let me see if I can open. So this will be like, this is our echo machine.
Wow.
That's
So-
when the probe is inside,
Yeah,
right?
when the probe is inside, but this one is a regular one. This one is not with the probe.
Okay. Oh,
And
okay.
this one was done without the probe.
Probe, okay.
So this is just a basic standard one. So the key thing also that we've done here, everything here is networked, right?
Wow.
So when they're doing this study, that's what's having open up. That's another image management system we have called SIMS. So you can, I can log into this from Lagos, from Abuja, from even as they're doing studies. In October, we were in Nigeria. Well, we're still in October. We're in Nigeria, September, October. And I was able to log in and then look at studies and provide reports. And then, so the report goes on electronic medical record system, and you can press a button, email the report to anyone, anywhere in the world.
Wow.
And so this is done seamlessly.
That's great.
So right now, you can even stay here, because somebody told me they already started doing it. You can even stay here and analyze some patients back home.
Yeah.
Some patients, right?
Okay, I'll show you. When we go up, tell Eric to be upstairs so he can show. So the clinic we have in Enugu, for example, when we set it up in such a way, when they do Holters, right? Even now they're ECGs. We give them this one. So when they do it, somebody sits up here and then analyzes it right away. But it just comes with somebody having the will to. The technology is there now, to do these things. But you have to have people who are committed and determined to use the technology properly, and get these.
I think
services.
I would like my husband and me to connect because he's a pharmacist.
Okay.
They're trying to do tele.
Yeah.
So
telemedicine, we support several islands in the Caribbean. We have patients in St. Kitts and Nevis and elsewhere. We take care of.
Wow.
That's good. They're trying to do to have a something.
Hold on, I don't want to take
A
it.
lot of teaching too.
Okay, so, wow.
As you can see, everything is just about continuous learning.
Jesus.
We have conferences every Thursday yesterday we had a conference.
Yeah, wow.
Every Thursday and every Monday. And in January we have Masters of Medicine. I host Masters of Medicine conference once a year.
We are here.
Yeah, and international leaders, the people that wrote the book, I invite them, they come and they debate. So this January we're doing it with Yale University.
I will bring you to talk to Igbo leaders because I connect. So I will be speaking to them in the I'll let them know you will be speaking. One of them, I want to bring you in to talk to them.
So establishing this practice required a
You
tremendous
just want to show us some place that will go.
and
If you want to go.
Listen over here. That was a good question.
and that investment was in part from Jamaican government or
No, it's an entirely, no.
entirely private, not even a public-private.
Really?
Yes. His father paid a lot of money.
Well,
But it contained.
in Erochukwu.
They had a
I run this dog.
the professor, he's the one kidnapping all the people.
We have to go. We have to go. We have to go.
You know what? Anytime.
I know. Because he wants to, he said that the restaurants close at 6 o'clock. He wants to live here right away. Restaurants. That's what he said.
Yes. In the whole place?
Yes. In this area, New Kingston, the restaurant I want to go to today, it will be closed at 6:30.
Oh no, we are gonna.
That's the thing. It's not like the Barcelona, they close down at 9, 10 o'clock. It's not that here.
David, let me get caught here. Go ahead, it's too long.
No, I'm maintain on YouTube. I YouTube it, even if it's 1 hour. That's a limit.
So you can't pause it.
You can always pause.
Because right now, when I got one.
So our intensive care unit and telemetry. So we have 11-bed ICU capacity.
Yeah.
Have 11-bed ICU capacity. So we use 6 of them for dedicated cardiac ICU, and then the remaining 5 for telemetry and medical ICU.
Wow.
Right? So all the rooms have head walls that is piped for oxygen. We have oxygen, you have vacuum, you have medical air, right? And every room has a ventilator. So you can put patients on a ventilator. So this is a vascular profile machine. We're the only ones in Jamaica that can offer vascular profile studies.
Wow.
We also do, on the other side, we didn't show you the tilt table autonomic function lab. We're the only ones that can do autonomic function. So we offer that service for patients. So these beds are all ICU beds with volume studies and everything, so we don't have to get the patient out of bed to weigh them. We can get all that.
Wow.
So this is portable X-ray from the unit, right? So that you can take X-ray, right? And they also have a C-arm.
Wow.
Sometimes.
Whoa. Look at this.
Use, right? And then when we go, they don't have any case, so we can.
This is like United States Hospital. You know that? Jesus.
So, we are anyone in the ICU, but this is our nurse and our doctor, Cashel.
How are you?
So these are very prominent people, right? That you can say, I'm also a chief, even that I'm my chief. So they don't take me
Lightly.
They have to respect me as a chief.
When it comes home, it speaks, everybody listens.
So we have show the ONOMED platform for inpatient reporting, briefly. And I think we have, this is our central monitoring station.
Oh, wow.
So that when all the patients here, the staff can sit here and then see all their profile, oxygen saturation, electrocardiogram, everything, their blood pressure, and so on. You have that? Just okay. So this is where you can
see the
They
patient.
match admissions, ICU, telemetry, emergency room. They can see where people are. Like, where do you put your notes?
Here.
So exactly. So this is a system. So we also have what we call air handling. We have what I call those things, air handling units there. So we have filtration of the air. So we have 20 to 25 air exchanges per hour in this place. So as we're talking, it's changing out the air.
Wow.
Sucking it out.
Amazing. Now I know why they say he has the best hospital in Jamaica. Now I know. Yes, yeah.
Telemetry units. That's our
Ah,
carry.
okay.
Yeah. So this is the central monitoring. So those patients in there, they can just sit here
Sit here and monitor their heart rate.
and monitor their heart rate.
Wow.
And then we also think music is a very good thing. So we are wired for music.
Wow.
And Monday, I wanted your people not playing music for my people today. It's okay. So the same ways, head walls that we talked about,
Oh, okay.
all the rooms.
Hey, Amadi.
One has head walls.
Wow. This is amazing.
Yeah.
Press the
This is
No, we have our own surgeons. We have two full-time cardiac surgeons.
Oh my God, people, wow.
And then we have our interventional
Can you see this? Can you see this?
Yeah.
Can you see it? Can you see this?
So we don't have former residents coming here, but we have fellows from Yale University come here to do their rotations. We have residents from universities across the world coming at the same time. One of the young men you saw there is from St. Kitts and Nevis. And actually I have a young guy from Nigeria who's going to come and study.
Wow.
So who's the major surgeon?
Huh?
Who would be the major surgeon?
We have several surgeons, depending on, we have cardiothoracic surgeons, we have general surgeons. Dr. Gary Wagner is a general surgeon. So we do all kinds, we do non-cardiac surgery as well. Dr. Melvin Hardy does hysterectomies and so
My
on.
cousin recently died of heart issue.
You should have been here.
We do vascular, we do cardiac, we do open heart. Unfortunately,
Can you imagine this?
so we have a private company, Antennalos from Italy, to do this. That's why this is the only place in Jamaica that I'm aware of that has watertight or airtight city. It is not to say they're done specifically for operating theater. You see this thing is a laminar airflow hood. It's a complete corridor of air. So you have two of these. What's recommended usually is 100 to 120,000 locks minimum, or we take 150,000 locks here, 150,000 locks here, 300,000 locks. So when our surgeons are operating, everything is crystal clear. Right? And then you have this monitor here. So when they're over here, instead of bed, they can see all the hemodynamics in here. They can also see the perfusion thing there, and they can also see it on this one. So you have 3 points, and then this one sends data while you're operating in real time.
Wow.
We can transmit data through here. So if you have like a surgeon in Lagos who's an expert in something, and our people may say, okay, fine, we want you to participate. he can log into and then look at the monitor and say, oh, I think what you are looking at, maybe this or that. Right? And so this is a hand-log machine. It's a recent one, Sorin S5. We have a heater cooling system in there. And then we also have, this one is, what is it? What is this? Balloon pump.
Who? Balloon pump?
Balloon pump.
Wow.
So when somebody goes into cardiogenic shock, we can use this thing to go in and then keep them going
Wow.
while the case is going on. Right? And then you also see on the wall that we have antimicrobial panel. It's a company from Canada came and did it called Damtrack. If I place my hand here for 30 seconds, 99.95% of the bacteria in my hand will be dead.
Wow.
So this is extremely clean room,
Clean,
right?
clean. And then you have all these UV lights. So okay. For surgery, we turn them on. So, you know, we're able to walk through here because there is no case planned. And then they will now come and deep clean this room. When they do, before the cases, they will deep clean the room. This is a static floor. They deep clean the room, and then it's out of bounds. Nobody can come in except the surgeons everywhere sterile.
Wow.
Right?
Yeah.
And this one's sucking out.
And then we have music while the surgeons are operating.
Wow.
They can listen to music. We have waste anesthetic gas disposal system. It's the only one in Jamaica. What it does is when you have lung surgery going on, you don't have, because what happens when I give you anesthesia and I'm the surgeon, some of the anesthesia is leaking out. So if I'm operating for a long time, I can get cognitively slow.
Wow.
The effect of that. So what he's holding there is waste anesthetic gas disposal system. It sucks out so that other than normal fatigue, you're not going to have, you'll be excellent at yourself. And you will notice that we have crash cuts all over the place.
Wow.
All of that. This is
Wow. Amazing. Amazing.
you know, when we step out, you will see it is all over the place. We have stress lab, ICU, telemetry, and so there is anybody going to cardiac arrest who can understand.
Wow. What? This can be you gotta replicate this one in Igbo land, okay?
No, that's our dream.
Please, this has to be replicated in Igbo land. The period. This is fantastic.
Dr. Madu, on a bape with you.
And so this lab is also where we do chronic total occlusions and complex cases.
Okay.
You see another crash card there too.
Exactly.
What's crash cow?
Crash card is so, you know, if somebody has an emergency, they're able to access all kind of resuscitative medications.
Oh wow.
Clear. Everything clear. And this is clear.
Wow. Wow.
We have a lot of defibrillators.
Wow.
So these wires are wires that we use to do investigations in the heart. Run the wires and then take pictures. And this is what the stent looks like. So, you know, when they now size the vessel that has an obstruction, they open this and then prepare it and then deploy
They put it in and it opens the way. It opens and the blood starts flowing to the heart.
Wow.
This is a catheter. This is what we used to go in through there and then
Wow.
inject and then see.
Wow.
And control from here is where when they're going for cases, then some other staff members in the control room monitoring and then reporting back. We can
Oh, okay. Well,
Okay, that's the man of the moment. This is our chief interventional cardiologist.
oh, wow.
Good evening. How are you?
Ahmed Suleiman.
Good to see you.
Man.
He's the one that does the magic.
Wash. Okay.
These are prominent leaders from my place. You know,
Where are you from?
I'm from Egypt.
Oh, wow.
So you're an African man. They were Christian. What about Jamaica?
Yeah. We just had there now malaria free. It came out in the news a few days ago. Egypt is now malaria free. A few days ago. The first country in Africa.
Really?
Yes. Yes. I know.
Wonderful people are doing an excellent job.
Wonderful. I mean, fantastic.
This is world class.
Super world class.
I'm proud of our son.
It's a nice school.
My brother not gonna talk much. That's what he teaches. He lectures. He teaches on Igbo.
You know, the